If a child is diagnosed with myopia, the optometrist should communicate to the parent the issues around myopia, that as it progresses, and it's likely to progress or get worse in children, that this can indicate higher risks of lifelong eye disease, and so the why of why we need to do something about it, why we don't want to sit back and just watch their prescription get worse and worse. So what the parents should expect is information about the different sorts of treatments that are available for children, that we don't just give them a straight pair of glasses to correct their vision for long distance, because that can influence how their eyes work up close. We need to look at how their eyes work up close, and we need to talk about options like contact lenses and like eye drops that can help to slow down this worsening of short-sightedness. This is called myopia control. There's been research on particular types of spectacle lenses, so spectacle lenses that have different focuses in them, multifocal or bifocal spectacle lenses. There's research in multifocal contact lenses. So these are lenses that have different zones of focus in them that change the focus demand for the eye when they're reading, or change the focus demand for peripheral vision compared to central vision.
There is so much research that shows much better ways to help correct and control the progression of myopia in children, especially the younger ones who start earlier. And research has shown that the earlier you start with myopia control options, the better chance they've got at slowing it down so it doesn't turn out to be a much higher prescription when they grow up.
More recently, over the past 10 years, we've started to understand more about contact lens options. And there's a contact lens you wear overnight and take off in the morning called Ortho-K, which has shown lots of strong research results for myopia control. And we have increasing soft lens options as well, because not everybody has access to these rigid lenses and not everybody wants to wear them. So there's rigid and soft lens options. And there's even eye drops, which have been shown to slow down that progression of short-sightedness. So it depends on the person. It depends on a child's capability with contact lenses. It depends on how quickly they're progressing, on their prescription. There's a whole host of different products and tools that are available to the optometrist, and we shouldn't settle for just prescribing a straight pair of long distance glasses for a child with progressing myopia. That's simply not the standard of care anymore.
At the UNSW Myopia Clinic, when we see a myopic child, we do offer various treatment options. They include atropine eye drops, orthokeratology lenses, multifocal soft contact lenses, as well as multifocal spectacles. There is individual variability to responses to treatment, and we are unable to, at this point in time, predict which treatment will work best for an individual child. Therefore, at our clinic, we recommend a couple of treatments to the patient and explain the pros and cons of treatment as well as gaps in current research. And after discussion with the parent, the child, we are able to make a decision on the treatment that we believe will be the most effective.
It's important to consider the treatment options that are available to you and to work out what works best for you and your child and your family, because it will be an ongoing process, the treatment programs that we work with. You'll expect to have fairly regular eye examinations. Some children, when they get diagnosed with myopia, develop their myopia very, very rapidly. So if you're waiting 12 months, 2 years to do your next checkup, you may be waiting too long. So
higher levels of myopia, above 5 to 6 diopters, which means that someone can't see clearly past about 20 centimetres, that has higher risks. And it's because the eyeball has stretched so much that there are higher risks. So we might take a more aggressive treatment strategy. We might need to be really active, applying all of these treatments or combinations of treatments to try and slow down or stop that worsening and to try and stop the eye growing and stretching too much. The really key message here is that we don't have to sit back and watch our children's vision get worse and worse and worse every year. There's things we can do about it. There's special types of spectacle lenses, contact lenses and eye drops that can help to slow down, or if we're very lucky, even stop the progression of short-sightedness.